All right, so we'll pick up where we left off. Atrial fibrillation. Um, when your heart beats, it beats in synchronous. You know, it beats one, you got four, you got two ventricles and two atriums. And so they beat, one beats, the next beats, the second, you know, they go from chamber to chamber, and that pushes the blood into the body and back up to the heart, you know, to the brain. If the top two chambers is your atrial part of your heart, if it is not beating in synchronism with the ventricles, then these are beating in, you know, different spots up here. When that happens, when one chamber beats, it's supposed to push it to the next, and then it pushes it on to the next, and it goes through all four. If it doesn't beat at the same time or right when it's supposed to, then you can get blood to pool in that chamber of the upper chambers of the heart. When blood it doesn't empty all the way out, or, you know, some of it stays there, then you can start to form clots. Our body has factors that makes our blood thicken quickly, which is a survival type thing for our body, but it can be bad if it doesn't beat the way it's supposed to. So if the heart beats abnormally, it can cause blood to pool, which can put you at risk for having a clot. And then if you do break that clot loose, it can travel to the brain and it can cause a stroke. Atrial fibrillation, some people get shocked out of it. Some people live with it chronically. But there is medications to control it, to keep it, the rhythm, the rate down to where it's within a regular heartbeat, because it can beat a lot faster. So you've had atrial fibrillation. Yeah. You live with it chronically. How long have you had it? Years?
That we know of in February. In fact, we were just with his heart doctor today, and with his other health issues, shocking's not.
No, he's not a candidate for it.
He's on another type of blood thinner, but
Yeah.
not the kind they want him on, but he's not a candidate for that either, so
Oh, wow.
just pray.
Yeah, yeah. And just, you know, keep going back to the doctor and stay on those medicines. I know some of them, you know, make you feel funny, but, you know, keep the rate down is the main thing with the atrial fibrillation. What about smokers? Do we have any smokers out there? Uh-oh, only one, my little sister. I might have to beat her. If you smoke, it doubles your risk of having a stroke. So you know, smoking is bad. Cholesterol. Cholesterol is the fat-like substance that we have in our bloodstream. Cholesterol, when you go to the doctor, they'll check annually, they'll check your numbers. You want your numbers to be below 200. You control your cholesterol by your diet, your exercise, your activity. And if you can't get that number down, try. But if you can't get that number down, there is medicines like Lipitor that the doctors can give you to help get that number down, because like I say, that puts a lot of fatty substances in the bloodstream, which thickens the blood, which can cause you to have a clot. Diabetics, is there any diabetes in anyone with diabetes? Yeah, so you are 2 to 4 times at higher risk for having a stroke. Keeping those blood sugars under control, watching your diet, exercising. Exercising doesn't have to be that you get out and do cardio physical, or, you know, you run around, jog, do all that. It's something as simple as a brisk walk. You know, try to do that when the weather's good, or some yard work. We all love yard work, right? I love for my... So, but those are ways to be able to keep your diabetes under control. And check it. If you're on insulin, you know, it doesn't always work the same. If you're sick or you're running a fever or you're not eating the same, it's important for you to keep a good eye on your blood glucose levels. Again, physical activity, your daily exercise, that reduces your risk of stroke. Your weight, decrease your sodium and your fat intake. That helps the whole picture. You know, it helps the diabetics, it helps with your weight, it'll keep your blood pressure down and hopefully reduce the risk of having a stroke. There's some things that we just can't do much about, like your family history, our age, gender, and if you've had a previous TIA. Like I say, it's very important for you to know the signs and symptoms of a stroke because that sets you up for being at high risk for a stroke. All right, so the signs of having a stroke. If someone is suddenly feels some numbness or some weakness to the face, arm, leg, especially if it's on one whole side of the body, that is a stroke. That is a stroke. Sudden confusion, trouble speaking or understanding what you're trying to say to them. If they have trouble seeing, if your vision goes blurry, it can be in one eye or it can be in both eyes. Sudden trouble walking, you feel dizzy, you lose your balance easily, you just start staggering and just, you know, you just can't control your legs, one side or both can just go out on you. Or if you should have a severe sudden headache. Usually the headache, the severe headache, can be more of a hemorrhagic stroke than ischemic. The number one thing to remember is act fast. Dial 911. Time lost is brain lost. If we get, we at Norton, we are one of the stroke hospitals, and our goal is the minute they get in the door, we know when they're coming. Call an ambulance. Don't try to drive them there because the ambulance goes ahead and sets it up at a stroke center. They'll pass these little hospitals. They'll get you to a stroke certified hospital, and we know you're coming. We're prepared for you. The most important thing to remember if someone does start having symptoms is what time is it? Look at the time. If you get to the hospital within 3 hours of having stroke symptoms, and we know for sure that's the time, if you are a candidate, if you've not, first of all, we do a CT scan to make sure you don't have a brain bleed. And then if you don't and you are a good candidate for a medicine, there is a clot buster medicine that they can give you if it's within that 3 hours of time. And, you know, that might save your life. It might keep you from having long-term, really bad disabilities. So the most important thing is to act fast. If someone is having these symptoms or you yourself, call 911, get them the help they need. And like I say, you might reduce the long-term disability or, you know, keep them from dying. I have some little cards up here that's good to put on the refrigerator just as reminders. And they have the acronym of FAST. FAST is the easiest way to remember the stroke symptoms because, you know, when you leave here today, you'll say, now what was those, you know, those symptoms that she was talking about? The face. If they're looking at you and one side of the face is kind of drooping, you know, the mouth is going down or the eye looks like it's just, for some reason it's slanted down on one side or the other, ask them to smile. If they can't, when they smile or try to, both sides of the mouth should go up. If both sides of the mouth don't go up and one stays put or is lower, call 911. You only need one symptom. It don't need to be more than one. Ask them to hold both arms out. If when they're holding their arms out and one starts to drift and they can't lift it back up, that's the symptoms of a stroke. They have no control over that side. They're going to lose the whole side of the body. Ask them to speak. If their speech is slurred, they're not quite, they can't say their words, or ask them to say a little sentence. Johnny went to the well. You know, if they can't concentrate and say that sentence back to you, then you know they're probably having a stroke. T is for time. Time is the most important thing. Know what time it is. Like I say, call an ambulance, get them to the hospital, and maybe, you know, you might keep them from having long-term disability from a stroke, or even death. Does anyone have any questions for me? No? Okay. All right, everybody pass the test?
I didn't get it right.
Okay. All right, well, I do appreciate it. Like I say, there's all kinds of information up here and some little cards for everyone to take home, and it's from the National Stroke Association, and I do appreciate your time of letting me present this today. And as I go to school, I may come up with more good information. Thank you.
Thank you, Mary. All right, let's all stand for it, please. And if you would please, if you fill this out, just leave it on your seat and I'll pick it up when you all leave. And word it will be dismissed. Yeah, we're dismissed.
Shake my
All right,
hand,
thank you.
Wait, song, you can't song.
Still on. I guess I need to stop it now, huh?